This is one of Hayden Trainer's rare trips into Canberra to see his team of physiotherapists. Usually they come to him.
Yeah, so we actually see Hayden once a week in Burrawa. So we have a physio that goes there once a week, and on the alternate week we have an allied health assistant who goes out there. And that just means, Laura doesn't have to come in, which I know is really hard for her.
The now 6-year-old was diagnosed with cerebral palsy after having a stroke at just 3 months old.
For the last 6 years, he's been a right hemiplegic and faced struggles every day. Wild one.
Through therapy, Hayden has learnt to walk, dress himself and make his own breakfast.
I think that he'd be completely crippled without all of this intervention that we've done. We were lucky enough to get streamlined onto the NDIS early.
But new NDIS pricing for physiotherapy means Hayden's home visits are now in doubt.
I think we're all feeling a bit down, a bit deflated, a bit undervalued at the moment, and having to make lots of decisions, really tough decisions.
The National Disability Insurance Agency reviews costs every year and has been hunting for savings for some time. This year, some price limits have been lowered to bring them in line with what Australians not utilising the scheme pay. From July the 1st, physiotherapy will be capped at $184 per hour, a $10 drop. Dietitian and podiatrist appointments will be capped at $189, a $5 reduction, and claims for travel will be cut in half. Miss Caldow's considering overhauling how her clinic operates.
We have to make a decision whether we continue to see children by travelling but then put our business at a huge financial risk, or whether we say, no, sorry, we can't see these clients, and that's an awful decision to be making.
The thought of Hayden's home visits stopping is hard for his mum Laura to contemplate.
It's devastating, honestly. It's just a real kick in the guts. We already have such a lack of services.
2, 3. John is 5 years old. He's very cheeky and he lives with a genetic condition called spinal muscular atrophy.
It's a disorder that causes progressive muscle wasting and means John needs equipment to move, eat, even sleep. Occupational therapist Katerina Senga has picked and fitted every piece, a job that's required regular visits to John at home.
It's more than critical, it's essential. Without having someone able to come to your house, your child will miss out.
Occupational therapists are facing a 7th year of price freezing. Combined with the looming travel cuts, Miss Senga had to let her team of therapy assistants go.
We literally had to make phone calls today and let them go.
She is also considering charging a gap fee for out-of-clinic visits.
For us, the gap fee would be that 50% that the NDIS has taken away.
It's an extra cost John's mum isn't sure the family can afford.
Having a gap fee would mean either we miss out, we can't afford it, therefore John misses out, or we would have to then prioritise something else that gets missed in order to pay for it.
The NDIA says the changes to hourly rates are modest and ensure participants are paying prices that are fair and in line with industry standards. As for the halving of travel claims, the agency insists that's in direct response to feedback from participants who told them excessive claiming by therapy providers was draining their plans faster than expected. Michael Perusco believes it's time for the scheme's pricing to be done independently.
Like aged care, like health, we think it makes a lot of sense for pricing in the NDIS to be independent. That ensures that people get the support they need and providers are compensated for the level of complexity of their work.
He says the longer it takes, the bigger the exodus of providers from the sector.
If that occurs, participants suffer, and particularly those with the most complex needs who need the NDIS the most.
Yes, it will look great to save a few $1 billion, but you're saving it on the back of the most vulnerable people that can't speak up.
A prospect completely at odds with the scheme's very aim. Rosie King, ABC News, Canberra.